Hello, South Ribble. It's Katherine Fletcher here again, your local MP, joining us. Thanks for joining us for this third live Facebook Q&A session. As we've done previously, I have a few questions that have already been submitted in advance. Then then we'll move to questions that have been submitted live. Either post them in the comments column, we don't know which way that is, and we'll pick them up and try and answer as many. Hope to be about half an hour today, I think. So I have the first question in from David. He's asking about care homes within South Ribble, specifically how many care homes, how many of those care homes have got confirmed COVID cases, how many have needed to order extra PPE, and is there any correlation with the CQC ratings for the care homes? David, not all of that data is available to me. So there are about 29 care homes, I understand, within the South Ribble area. It's centrally correlated in terms of who may or may not have a COVID case within it. What I would say is that the local Lancashire Resilience Forum, which covers the whole of Lancashire and unusually in the country, has done a fantastic job of pulling all of the different councils from Blackpool to Pendle to Blackburn all together and working as a cohesive unit. What they've done is some really great work along with the Lancashire County Council team to understand where all the care homes are, understand what needs they have, understand what PPE are. I know that they're speaking to them daily in terms of different cases and their needs and gathering data. So whilst I don't have the figures, I have every confidence. Actually, it's been really dealt with brilliantly by Gold Commander and the Silver Commanders and the Bronze Commanders within the local Resilience Forum. And if I can take this opportunity to just say thank you to all of them for all their amazing hard work, including using their initiative to order huge amounts of PPE for us here in Lancashire well in advance. I think that the care home sector is maybe getting slightly unfair criticism. I think I almost agree with your point. I think I've mentioned before, I paid my way through uni working as a nursing assistant in a care home. It's a tough job and they're doing amazing work. So big thank you to all of you out there. That's very good. I will help if I can. Right, let me move on. There's a question about the numbers. There's lots of questions about the numbers of cases in Lancashire. What have we got in terms of the data, and why it appears low, and does that make any difference to us coming out of lockdown? I'm going to return back to coming out of lockdown, and we're anticipating a statement from the Prime Minister at 5 as well. But let me just say again how well the local Lancashire LRF are doing at both having an intelligence cell, understanding the data from across Lancashire, making sure we've got a coordinated response. The figures are centrally collated. I know they're all over it. What that means is for us is we still need to follow the central instructions. Even in the most affected area in the country, it's probable that maybe only 15% of the population have had it. Now, what that is in Lancashire is probably slightly less, but we don't know. So it's the message about social distancing, about staying home and saving lives, and about letting both government and local resilience groups to do their great work, I think is absolutely key. Ian has asked, have we considered reusing PPE like they did in the Ebola outbreak after sanitisation? And also, is the NHS discharging patients that are COVID positive and potentially spreading COVID into care homes? Are there any statistics on how to stop it? Ian, very good question. I think the first priority is not necessarily about reuse of PPE. I know there's been some examinations about how to do that safely, and I think that's wonderful. But as I understand it right now, Lancashire NHS has enough PPE. Has exactly what it needs. That doesn't mean that we should become complacent about that. You know, there are not enormous stockpiles for weeks and weeks and weeks, but right now we're okay, and there is no need to reuse PPE. In terms of the Lancashire Resilience Forum, I also understand that they have enough PPE at the moment, and they're doing great work to understand where that can be best used and best placed. So if people have a different view, please do get in touch directly with the specifics. like I've said previously, I'm happy to pick up anything that's with specific examples, and I have mechanisms to raise that with ministers or with the local groups to understand. But right now, I think we're okay for PPE and don't need to reuse. In terms of the NHS and statistics on COVID positive patients being discharged to care homes, I'm going to be honest and say I don't know. So can I take that one away and maybe come back, Ian, on either a reply on the forum, or if you want to email me in directly. I have heard some concerning reports of that, but there's lots of anecdotes knocking around at the moment, and I'm keen to only deal in facts. So if you've got an example that you know of that you'd like me to investigate, please do get directly in touch. Viral transmission, this is from Simon. Viral transmission is dropping. The NHS is under capacity with spare beds. Why are we still in lockdown? Simon, it's quite simple. It's all about the R value. So I've mentioned before, I'm a member of the Science and Technology Select Committee, and we've been really busy over the last few weeks having lengthy hearings to listen to the different scientists in different streams of work. We have done a fantastic job as Lancashire and the country in making sure that we didn't overwhelm the NHS. We didn't have so many cases that we couldn't cope with. But until the scientists are confident that we have that R value, that value of how many people are infecting other people with a disease, we need the population R value to be less than 1 for us to be confident that we're in control of it. So we're still in lockdown, practicing social distancing measures, only going out for essentials, because we're still not quite sure that that R value is in place enough to make sure that we can manage the pandemic moving forward. That may change in the future. What I'll never do here is speculate. I don't think that's the right thing to be doing. Okay, a similar question from Ian about reopening shops and restaurants. How can we get some areas reopening with social distancing in place? I know it's something that I was on a call with the Department of Health ministers this morning, and I know that's something that's really focusing the mind at the moment. You know, we can't stay like this forever, and how do we start to return to normal whilst making sure that we're in control of the viral transmission and keeping that R value super low? Again, I won't speculate. I can see there are a number of different options. And there's some interesting ideas, including using apps to help us make sure that we're aware of the transmission rates within the community. But I'll come back to that later, perhaps. So another question, the NHS sending elderly patients back to care homes whilst positive for COVID. Why are the NHS with spare bed space spreading the virus to those most vulnerable? Simon, I think I refer you to my previous answer on that. I have heard some concerning reports, but I've investigated a couple and not found anything that actually isn't anything other than speculation. On the call this morning to raise some specific issues on your behalf with the Department of Health ministers, there was some confidence that this is under control. I haven't heard of anything. If anybody has, please get in touch. But I know that they're very, very, very focused on that because, as you say, the NHS has spare capacity, and what we don't need to be doing is, bringing the virus into those tight and controlled environments of care homes where it's very, very difficult to maintain social distancing with some of the more vulnerable patients. Phil has asked, councils are under severe financial stress coping with COVID. So what's the government doing to support the councils? Well, actually, to be fair, I think the team at the Department of Housing, Communities and Local Government have done a fabulous job here. So I know they've been releasing funding in tranches for various different aspects. And I think it was 2 days ago, they have released monies for all 3 of our local borough councils and also for Lancashire County Council. So I think, forgive me if I'm a little bit out, but South Ribble Borough Council has had about £1.3 million worth of funding to support them and their fantastic activities in the in the issue of the pandemic at the moment. And put that into context, the total budget's about 14 million. So annually, so 1.3 million is a very big amount of money to help them and support them. I think similarly, Chorley's had about 1.2 million, and I believe West Lancs Borough Council has similarly had about 1.8, 1.18, something like that million to support. And then probably most impressively, Lancashire County Council, who have been working very closely with the LRF that I've mentioned, have had about £56 million sent to them to help them give out the support that's needed to get Lancashire through this and make sure we come out of this happy, healthy, and with a business sector that is ready to bounce back. David has asked, other countries in the world are being seen to disinfect communal areas such as shopping centres or transport areas. Would we do that? As part of the Science and Technology Committee, I've heard evidence about this, and the scientists there are examining all of the different possibilities. What they do is they get all in a room, they all go through the evidence, and the chair of the SAGE committee, who is Sir Patrick Vallance, who you'll recognise from the telly, comes down to a consensus point from within that range of scientific evidence and discussion. Their view at the moment is there isn't likely to be benefit from that, but I think the government will always follow the scientific advice. So if it turned out that there was value, I think it's something that the government would consider. My own personal view, just based on my understanding of how the virus survives outside the human body, its survival contact time, and all, is that maybe it wouldn't be the best idea. And I say not necessarily because it wouldn't perhaps kill a few viral particles, but actually the knock-on consequences of engaging in that activity. So would it put the workers at risk who are actually doing the spraying, or would it have a detrimental environmental impact? Or so it's like all of these things, it's not just about how we prevent COVID from spreading in the human population to keep us safe, but it's always about bearing in mind the knock-on consequences of our activities in other areas. So my own view would be probably no, but I know that the government will be listening to the scientific advice. This is from Jane. Yesterday's sad figures of deaths jumped due to the inclusion of care homes. Yeah, sorry. Do other nations' figures include these deaths, or are we alone in this transparency? Jane, it's a good question. And I think it's important for me to say, for anyone that's lost someone during this pandemic, I'm very, very sorry. My sincerest condolences to you. It's unprecedented, but that doesn't mean that every death isn't a personal tragedy for the individuals involved. In terms of transparency of our response, I think we're making every effort to be the most transparent in the world. You know, the inclusion of the deaths gives a more realistic picture. I know that it's a really mixed bag in terms of parity of the data reporting. So, for example, I don't believe Spain's figures includes care homes deaths. France does include some. I don't think the Americans do. So it's quite hard to get a level playing field. What I do know is that the chief medical officers of all 4 home nations, including Professor Chris Whitty, are spending a lot of their time talking internationally to both share and compare data. Because ultimately, remember, it's the data that helps us understand where we are with this pandemic and informs the evidence about what to do next and what's the most effective thing to do to keep people safe. So they're sharing data, but they're also sharing ideas. You know, this is the human race against a virus. This is, and it's something that's really heartening to see, that kind of pan-national cooperation. So the short answer, Jane, is we are being transparent. I'm not sure to what extent we can read across, but I'm confident that when we do have data, we're sharing it, and quite rightly so. And then finally, this is not one from one individual, but I've had lots of questions about support for businesses and how to make sure that businesses, don't need to fold due to these unprecedented times. Just wanted to remind everybody about the announcement around Bounceback loans that's been made recently. I've been doing quite a bit of work behind the scenes. It doesn't necessarily need to be public to be effective. Working with the Treasury ministers, kind of raising the issue of smaller businesses, that the Sybil scheme is wonderful for larger businesses, especially those who have a track record of lending and borrowing with their bank. But the smaller you get in business size, the less likely it was that you'd previously borrowed from the bank and had some of the administration in place. And what that meant is that the loans could be taking a really long time to come through, which is absolutely not what's needed right now in the middle of this crisis. So raise that point repeatedly along with other colleagues. And what they've done is come back with this Bounceback loan scheme, which the government will underwrite to 100%, which has no fees or charges for 12 months and will allow you to, any business, to borrow up to £50,000 and get access that quickly, because the 100% government guarantee gives the financial institutions the confidence that they can put that money out and not lose money. Now, there's been some misreporting in the press saying there's a turnover cap on that. No, any business can borrow up to £50,000 quickly, or up to 25% of their turnover. So, but if you turn over £500,000, you can still borrow up to £50,000 quickly using this Bounceback loan scheme, perhaps to kind of cover the gaps between Sybil's appearing. I think what I might do is now switch over to some of the questions that we've got coming in on the live feed. You'll have to forgive me. I'm just going to do a bit of scrolling up. So Chris has said, excellent news about Bounceback loans for business. What's the likelihood of loans becoming tangible? Well, the whole idea of the Bounceback loan scheme, Chris, is that it's deliverable quickly. So I think I've just explained why Sybil's was taking a bit longer, because it was a more formal standard lending arrangement where security was taken and checked and So I would have they have been designed to be tangible. And if you have any problems or any issues specifically, please do write into me. I can speak to UK Finance, I can speak to the Treasury team. We can make things happen, and have done already for a number of people that have written in, to get them money. Robert, I'm going to have to paraphrase that a bit, I think, Robert. Given your background in biology, do you believe it's possible to somehow avoid a second spike of infections without an unacceptably drawn-out lockdown? Good question. And the answer, my personal view, is yes. It will mean some form of social distancing. It will also mean some form of technology input. I think it will also mean some form of advances in testing science and advances in vaccine science and advances in treatment science. But I'm not pessimistic about us finding a way to get out of this. But that's looking to the future. And what all of the communications experts and behaviours experts say to us is, don't speculate, give a clear message. And the clear message, until the boss, Boris Johnson, says otherwise, is stay home, protect the NHS and save lives, because we're not quite sure where that R value is yet. So I think we can, but right now, let's not get confused and just keep doing what we're doing, because we're doing a fantastic job. Wash your hands, only go out to when it's essential, wave at your neighbour, go out on Thursday nights and clap for carers like I will be doing tonight. And we'll get through this with British pluck. Stephen, hi, I'm self-employed limited company director who set up my business in September 2019. I've not had much luck gaining any clarity. Can you assist? Stephen, it's very easy for me to give you an answer. I'm really happy to help. I think Bounceback loans might be the answer for you, but what I don't want to do is do specific casework on Facebook Live. I don't think that's fair. So drop me an email, katherine.fletcher.mp@parliament.uk, and give me all of your details in terms of where you're based, business turnover, what schemes you've had access, whether you've got premises or not, and then I'll help point you in the right direction, hopefully. Lucy, hi Katherine, I'm shielded at the moment. How will the government ensure people like myself will be safe when we go out when we can again? Lucy, I think the shielding scheme is genuinely remarkable in that it was done so quickly to identify the people that we really need to put that extra safety blanket around in the community. So whilst I'm sorry that you're shielding, I'm really delighted that you get the protections that you need. It's forefront in everybody's minds to make sure that we don't suddenly lift a veil and expose people to risk again. And at the risk of sounding like a nerdy scientist, it's all about the R value. It's all about making sure that transmission's low and that the people that are most vulnerable are being protected. So I hope that answers your question, but I know that we're not wanting to expose anybody for the sake of anything other. All of this is about saving lives and nothing else. Painful as it is at the moment, and maybe in the future. You know, I don't want anybody to die that doesn't have to. And I know the government thinks that as well. Dave's asked, when schools go back, will we ensure those with special needs and disabilities are some of the first? It's very challenging for parents and foster parents to look after autistic children in particular. Yes, Dave, I completely understand that. There are areas where SEN schools can remain open if it's particularly challenging. So they're not on a block lockdown at all. So if there's something specific that you want to pick up, please do get in touch, as I've mentioned previously. What I would like to do is take the opportunity just to thank the teachers, both in normal schools and special educational schools. They've worked all the way through Easter. They're working really hard, even with a smaller cohort, to make sure that the children of key workers, or perhaps those most valuable in society, and apparently a small boy misunderstood what a vulnerable child was, and he said, no, I'm a valuable child. And hasn't he just got it right? So those valuable children, as well as the children of key workers, their teachers are doing a fantastic job keeping them in an educational environment so that we can keep going and their parents can keep going with work. So there is support available if anyone's struggling, and with anything specific, please do come into me directly and I'll do my very best to make sure you can get the help you need. Anthony's asked, can the council get on with potholes and essential roadworks while the roads are quiet? Other industries like farming and money to keep going. Anthony, it's a good point. I do know that some councils are taking the opportunity to do roadworks at the busiest junctions in kind of prioritising where the most disruptive roadworks are and getting something done. It's all down to, can their crews work safely? So whilst it would be wonderful to take the opportunity, it's the local leadership that will understand whether the crew can work safely to engage in a repair, and can they maintain social distancing, can they wash their hands regularly. I know that Lancs County Council are doing some, but what I wouldn't want them to do is encourage them to do it if they weren't being able to maintain safety as well. But good idea. I'm sure they've thought of it. They're doing a fantastic job at the moment. Deb's asked, certain hospitals in Lancashire do not have the correct equipment. They don't have full length protected grounds. Please tell me how this has happened. It's a disgrace. Okay. I don't know whether emotive language helps at a time like this, but I'm fair and I'll read your question. Your government should apologise to each and everyone putting their lives on the line due to the mismanagement of this pandemic. Deb, I would say that's a view. It's not one I hold. So speaking to the Lancashire hospitals, they have what they need. I know that there's fear out there where people believe they need, almost those things you see people wearing in the Ebola, very almost masks. All I've done is listen to what the experts in PHE have said. And there are a series of tables which I can share, which show what the appropriate PPE is for any given working environment. And to my knowledge, there is nowhere in Lancashire that doesn't have the appropriate PPE for their working environment. And it's not the government that has set what that appropriate PPE is, it's Public Health England. So I think, has it been perfect? No. I think I said on a previous Facebook Live, the NHS didn't have a huge logistics operation in place because it's not needed in normal times. And they've gone from trying to distribute to 249 sites to something silly like 50,000. So there was a lot of stuff sat in warehouses and it wasn't in the right place. But I've been monitoring it really closely, and I believe in the last few days, whilst maybe not everyone's got voluminous stocks, people have got what they need to do their jobs safely. Jason, hi Catherine, have we closed our airports yet? So the airports is an interesting one because it's one of those kind of almost emotional knee jerks. I must admit, when I saw that, I was surprised, but it's all based on the modelling, and it's based on what the likelihood of risk is with people coming and entering and leaving the country, and the difference it makes to the amount of disease in the population. And this is not from me, this is from the advisors to SAGE that were giving evidence at the Science and Technology Committee. The difference it makes with this COVID disease is almost negligible. So everybody that's coming in from the airports, they're being advised to isolate, they're being given verbal advice, but the likelihood of a person getting off a plane having it, given how it's spread around the world now, and the likelihood of the guy that you meet in the shop having it are almost exactly the same. And the volumes of air travel is so low that that number is absolutely tiny. So rather than cause disruption for people that really, really do need to fly, we've made the decision that it's all about public safety, and so we're leaving the airports open, if only to get people home. You know, I know there were a couple of South Ribble residents that were over in Peru, and boy, that was a mission. And I must say, you know, well done, Foreign Office people. It wasn't perhaps as fast as they like, but you know, lots and lots of very high level conversations to get those planes into closed airspace to allow us to get the British nationals home, and that's just one example. Hayden, Nicola Sturgeon today announced a newly self-employed hardship grant for Scottish people who are new self-employed that don't qualify for the existing scheme. Is that likely to be rolled out in England? Hayden, I'm really sorry. I've been prepping for this. I haven't seen that at all. What I can tell you is that I have raised the newly self-employed point several times with Treasury and made some suggestions about a scheme that I thought might have some potential. But what I can't do is start speculating about policy here. One, somebody in Westminster would get the thumb screws out, and two, I just genuinely don't think it's fair. So it's something that I'm thinking about, but it's not something that I have any detailed knowledge about in terms of, you know, schemes and plans to roll out. I know that the Treasury are considering it and have been doing so repeatedly. Rod Smith, our road is anything but quiet, and plus the speed it's getting worse. Rod, I'm terribly sorry. Could I ask you, I believe you've written in on that. I'm going to try and keep this to COVID, if that's okay. But thanks very much for, you know, watching this, and hello to you and yours. I hope everybody's all safe and well in your home. Mary, will you and your government apologise for all the avoidable deaths as a result of this foreseeable pandemic? Mary, I'm going to disagree with you. I don't see how this was foreseeable. Everyone says, oh, well, there's been a virus before. Well, what kind of virus? You know, it's a bit like saying it's a plant. Well, is it an algae? Is it a tree? Is it a fern? Is it a petunia? You know, the viruses are really different. It's just a very, you know, layman's term for it. So we had good preparations in place for one type of virus, the tree in this example, but then actually COVID has been so new and so different, has different characteristics, you know, that it wasn't foreseeable. If you think I get up, or any member of this government gets up and goes to work and thinks, do you know what, I'm going to do something really horrible today, that's not my experience of Westminster. I've only been there since December. There are people sleeping under their desks, crying. They're so tired. They've worked so hard. They've done nothing else for 3 months. You have my personal and categoric assurance that everybody's doing everything about a disease that the world didn't even know existed at the start of January, and we're not even through April. And we've done remarkable things. We know what it is. We know what it looks like. We know how to test for it. We know some innovations in treating. So, I don't agree. I'm really sorry. Andrew Ashton, why can't garden centres open with social distancing? There must be a lot of plants going to waste. Andrew, the horticultural growers in South Ribble, I've been speaking with them on and off for weeks now. I feel, you know, they've really got themselves stuck in a moment in time. So what they do is they buy the plants in over the winter, and then they grow them up, and this is their peak sales season. And I know it's causing a huge problem for them. What they do accept is that we're not doing this for fun. We're doing this because we're desperate to save lives. I think as soon as it's safe, I would support the garden centres reopening. And in the intervening period, anybody watching this in South Ribble, find your local grower. I know a lot of them are doing sales direct from the door. Let's go and support them because they do a fabulous job. Anybody doesn't know where the local grower is, come to me, I'll point you to the closest one. There's some fabulous stuff out there, and I know that they can do local deliveries, many of them, you know, for local social distancing. The truth is, though, that even though garden centres are outside, it's not quite yet. I want to say yes. I probably can't. As soon as we can, I'll be down buying South Ribble's finest bedding plants and maybe a tree. Ivan, can we open the recycling centres, please, to avoid all this fly tipping? Ivan, so there was an announcement a couple of days ago. Robert Jenrick, the Secretary of State, has asked the councils to look at reopening them to precisely that point you address. It's not quite as simple as, oh, just open it up again, because we've got to maintain social distancing. And you know, when you go into the gangways with the skips either side, it's really hard to be socially distanced there. So if you have fewer people in the tip, there's a worry about queues of traffic, perhaps queuing to get in. Do you need to give a ticketing system? So whilst it sounds easy to just go, yes, just open it, it's got to be done safely. I think I referred earlier on about the law of unintended consequences for disinfecting things. The kind of same is true. You know, you wouldn't want a tragedy to happen on the highway because we were trying to stop people getting too close to each other when they were using the tip. So the councils have been asked to open them, and I know they're working really hard to think about how to do that practically. And I look forward to seeing them come open in the next couple of days when they've found the right scheme to make it safe for all of us. Steve, Catherine, do you think that the PM will outline options in the process to reduce lockdown rather than just keep going? Steve, I don't know. I don't have a window into the Prime Minister's mind. I do know that it's you know, that's what they're talking about. The scientists are trying to work out what measures you can release and keep the R below 1. The politicians are listening to the scientists. I know they really want to do it, but I do support them being cautious. A second peak where we come out of lockdown and then we have to go into it again really would be very, very difficult for businesses. So let's do it once, let's do it right, and then we can all power forward in the certainty. Speaking personally, I hope so. You know, I haven't even so much as shook hands with anybody for 6 weeks. I want to go and give mum a hug. I get it. But I'm a human being, but I'm also a politician, and what I will never do is try and advocate for something that could put people at risk. It's just, I can't do it. Sorry. I know you want me to say something else. Andrew, do you think if the lockdown was earlier, people would have burnt out by now and start to ignore the guidelines? Would this be a bigger danger to the NHS? I don't know. I'm not sure, but that's what the scientists think. So when they were giving evidence about the start of the lockdown date, one of the major considerations about when to go into lockdown was lots of very clever people, a couple of lady professors that have come to talk about the behavioural aspects of lockdown, and how long it's sustainable for psychologically. When do you start to risk unintended consequences, perhaps with mental health difficulties, or even down to fairness? You know, if you're adhering to the lockdown, but you can see the guy 5 doors down isn't, or the lady 6 doors up isn't, that starts to become a problem of social cohesion with people getting cross with each other. So I know that they made the decision to enter lockdown based on when they thought the peak was. And I think Professor Whitty said repeatedly, the ideal time to go into lockdown is just before you're going to get the peak. And my guess is, I don't know, in fact, I'm not going to guess, it's not the right thing to do, but I know they thought about it very hard. Simon, we've left the EU. Simon, I'm going to leave this with COVID for now, if that's all right. Mary, yeah, you're making a very, I'm not sure your facts are about PPE are right there. And I'm not sure that I've answered you. I don't believe that a pandemic was I don't believe this was foreseeable. How you can predict that a type of virus that we've barely seen before can suddenly acquire a load of immunity, a load of proteins from a completely different animal, and it just so happens that if that gets into the human body, it can replicate whilst being asymptomatic. In fact, that's probably worth dwelling on, actually. That's part of the really unusual things about COVID, is normally when you are at risk of spreading a disease, you have symptoms. And it's looking like the scientific evidence suggests there's actually 2 or 3 days before you become symptomatic where you're spreading it, which is another one of the reasons why it's been really difficult to kind of contain it, because without a complete lockdown, because how do you tell someone that might have it that they need to stay at home? You know, and you can't test for it either because the disease is not there. Right, I think that, apparently it looks like you've started swapping garden centre tips. Do you know what? If there's any reason to stop a Facebook Live, it's people swapping garden centre tips over your erudite words. No, in all seriousness, thank you for joining us. As I've said before, in Lancashire, we are world class at KBO, which is keep buggering on. And I hope we won't have to do it for too much longer, but we'll definitely only do it when we're guided by the science. So stay safe. I hope you and yours are all well. And please do get in touch with me if I can help you. Thanks. Bye.